A 25-year-old man in Nevada may be the first person in the United States documented to have been infected with coronavirus twice. The study from a Nevada research team has not yet been peer-reviewed by a journal, but the researchers say the findings suggest people can catch COVID-19 more than once. Joining me now is Dr. Gigi El-Bayoumi, a professor of medicine at the George Washington University School of Medicine and Health Services. Doctor, thanks so much for joining us this afternoon. This is quite alarming and something that needs to be studied and verified, obviously, but if it turns out that people can catch coronavirus more than once, what does that mean for a vaccine?
Well, good afternoon, first of all. And yes, it is concerning, but I just want to sort of put the brakes on. Given the millions of cases that we've now seen, and this is the first report, we have to kind of be cautious in making big conclusions. The reality is, if you look at other viruses, there are different strains. We're learning a lot about strains of COVID, mutations, what's going to happen. Obviously, this is cause for concern, but if it was a widespread problem, just given the sheer numbers, I think that we would see more cases. Now, this speaks, though, to the importance of having good tracing, good databases, CDC reporting, sharing of information, both nationally and internationally.
Yeah, and again, it needs to be peer-reviewed and further investigated, but what is alarming is that it does appear that this man was severely ill both times, and from what I've read, it was two separate strains of COVID, so it wasn't as if he had the same virus that just came back a few weeks later, but it's good to get that perspective from you as well. Let me shift gears to the tragic death of actor Chadwick Boseman, the Black Panther star who died from colon cancer at the age of just 43. Should this be a wake-up call for others about the importance of getting screened regardless of age?
Well, we know that the recommendations for colon cancer screening had actually changed several years ago to screen everybody beginning at the age of 45, number one. Number two, I'm so sorry for the loss of such an incredible actor, such a talented actor who really packed in his short lifetime, a lifetime and a body of work that's just incredible. We don't know the specifics of his family history, what risk factors he may have. I think, though, that in Washington, D.C., we have the number one per capita cancer death in the country. And there are myriad of reasons for that. There's a huge disparity among African American and Latino communities versus white communities, social determinants of health that include the water you drink, the air that you breathe, the food that you eat, but certainly screening for breast cancer, colon cancer, prostate cancer, and lung cancer, which are the leading causes of death in men and women, obviously breast and prostate respectively for women and men, as well as Black, brown, white communities. So I think that this also brings up the point that there has been a plummeting of cancer diagnoses in the last 6 months. And I can tell you that this is extremely concerning because that's going to only get people to show up late, to get late diagnosis, late treatments, and unfortunately, worse outcomes.
Yeah, I believe he was diagnosed in 2016 with stage 3 cancer at that point. But you're right, bringing up COVID and coronavirus has delayed a lot of people from seeing their doctors. Statistics show that African Americans are, in fact, at a higher risk of getting colon cancer. Do we know why that is, and what can be done about preventing this type of cancer?
Great question. We know some things, but not all things. We know that that there are delays between the time that a person, let's say a woman, discovers a breast lump and her getting the testing and then the treatment compared to her white counterparts. That may be 3 or 4 months, which is, of course, inexcusable. We know that for the same stage of breast cancer, for example, there is a higher level of aggressiveness of the tumor. There have been different postulates, some relating to genetics, others to the social determinants of health. But I think that we really miss the boat and in the medical community of not looking at stress. We are now understanding that stress shortens telomeres, which are those parts of one's genetic makeup that can, when they're shortened, increase dementia, increase cancer, shorten life expectancy. There's a lot to learn, but we can begin implementing what we know now, and that is screening makes a difference. And even in COVID, colon cancer screening can happen, yes, in colonoscopy, and certainly for high-risk groups, they should get colonoscopy, but for others, they can get non-invasive Cologuard and other things. But I just want to implore people to not ignore their screening, and certainly if they are having symptoms, blood in the stools, change in bowel habits, weight loss, please seek out medical attention now. This is a matter of life and death.
That is for sure, and that is some great advice. Even in the midst of COVID, go to your screenings and see your doctor. Dr. Gigi El-Bayoumi, thank you so much.